So imagine taking a chemical compound that is engineered specifically to, plump up your lips or smooth out deep forehead wrinkles.
Right.
And instead of that, injecting it directly into the highly sensitive internal mucosal wall of the vagina.
It sounds wild, honestly.
It does. On its face, it sounds incredibly risky. But right now, it is actually one of the fastest growing lunchtime cosmetic procedures in the world.
Yeah, it really is. It's this procedure that basically promises to fundamentally heighten physical pleasure and amplify sensitivity by physically enlarging a very specific anatomical target.
Right.
But when you actually look closely at the timelines involved here, I mean, how quickly it works, when it's safe to use, and how long it actually lasts.
The mechanics of it all.
Exactly. You uncover this massive, just fascinating divide between the cosmetic clinics that are selling the procedure and the really cautious medical establishment that is pushing back hard against it.
Which is exactly why we are jumping right into a deep dive on the G-shot today,
Mm-hmm.
which is also known as G-spot amplification.
Yeah.
So if you are sitting there wondering how this actually works, our mission today is to cut through all the glossy marketing pamphlets.
There are a lot of them.
So many. We want to break down the absolute mechanics of the clock. We want to know the exact timeline of this procedure.
Right.
The onset of the results, the bizarrely contradictory recovery times that we found, and realistically, just the longevity of the enhancement.
Well, to map that out, we really have to start at the very beginning of the timeline.
Sure.
Because before we can talk about how long the results last, you need to understand the mechanics of the immediate onset.
Like what's actually happening in the room.
Exactly. What exactly is happening anatomically during those first 15 minutes you spend in the clinic chair?
Okay, let's unpack this, because the anatomical target here is somewhat legendary in itself.
Oh, absolutely.
We're talking about the G-spot, which is named after Dr. Ernst Grafenberg, right?
Yep, the German gynecologist.
Right. The guy who first researched this specific erogenous zone way back in the 1950s.
That is the man. And anatomically speaking, it is not actually a distinct, separate organ.
Okay.
It's more of a highly sensitive, roughly bean-shaped area located on the anterior or the front vaginal wall.
Got it.
So if you're trying to visualize the anatomy, it is situated about 2.5 to 7.5 centimeters inside.
So like 1 to 3 inches inside the vaginal opening.
Exactly, sitting right below the urethra. And this specific patch is incredibly complex.
How so?
Well, it's a highly vascular zone where the vaginal wall, the urethral sponge, and internal clitoral tissue essentially all overlap.
Oh, okay. Just to visualize that for a second. Vascular density just means the area is absolutely packed with a rich network of blood vessels.
Right. Tons of blood flow.
Which I guess explains why it's so reactive and sensitive to begin with.
Definitely.
But also why injecting something into that specific spot is inherently riskier than, say, injecting a cheekbone.
That is a crucial point to keep in mind for later. So the procedure to augment this vascular area is incredibly fast. The patient is usually positioned similarly to a routine pap smear,
Right.
and the practitioner locates the exact spot. And this often requires the patient's active guidance, actually.
Oh, really? Why is that?
Because the precise anatomical placement varies wildly from person to person. It's not a universal map.
That makes sense. And then comes the injection part.
Right.
So the doctor applies a local anesthetic, to numb the tissue, and then they inject a dermal filler directly into that anterior vaginal wall.
And the injection itself takes only a few seconds.
Wow.
Total time in the room is like 15 to 30 minutes.
But the fillers they are using, these are the exact same formulas we associate with facial aesthetics, aren't they?
Yes, they are.
So we're talking about synthesized human collagen or hyaluronic acid formulas, brands like Juvederm or Restylane.
Exactly. And the mechanical goal here is really straightforward. They want to physically expand the internal G-spot area to about the size of a quarter.
Or a 5p coin if you are listening in the UK.
Right. And the filler basically increases the tissue's thickness and its outward projection into the vaginal canal by about 3 to 5 millimeters.
Okay, so just plumping it outward.
Yeah. The working theory is that by making this specific patch of tissue significantly more prominent and voluminous, it becomes far more exposed to direct friction.
Right.
And stimulation during penetrative sex, thereby increasing arousal.
I do have to stop you there, though.
Sure.
Because we are talking about hyaluronic acid, which is famously marketed for the face.
Right.
If a clinician is putting Restylane into a vaginal wall, that has to be an off-label use.
Absolutely.
There is no way the FDA has robust, dedicated trials for that specific internal application?
Well, you've hit on the exact reason this procedure is so controversial.
I figured.
The hyaluronic acid fillers used in these procedures are entirely FDA approved, but exclusively for facial tissue.
Right.
Injecting them into the mucosal lining of the vaginal wall is strictly off-label.
Which is legal, though.
Yes, exactly. Off-label use is entirely legal, and it happens every day in medicine.
Right.
A physician just uses their clinical judgment to utilize an approved product for a different purpose.
Got it.
But it does mean the rigorous, long-term clinical trials that guarantee the safety of, say, lip fillers, they simply do not exist for vaginal applications.
Okay, so the off-label injection happens. The clock is officially started.
Yep.
Let's talk about the immediate onset of the physical change. We hear this term lunchtime procedure thrown around a lot.
A lot, yeah.
How quickly does the tissue actually alter?
The physical onset is remarkably fast, and that really comes down to the biological mechanism of the filler itself.
Okay, how does that work?
Think of hyaluronic acid like a microscopic, highly aggressive molecular sponge.
A sponge?
Yeah, it doesn't just sit there like an inert lump of plastic.
Right.
Once it's injected, it actively attracts and binds with ambient moisture and water molecules in the surrounding mucosal tissue.
Oh, wow. So it actively pulls water in.
Exactly. It inflates itself. The targeted area plumps up and expands significantly over the next 30 minutes.
So we have an off-label filler acting like a moisture magnet, plumping the tissue almost instantly.
Yep.
And because there are no incisions, there's no major downtime.
Yeah.
Like you can get dressed, walk out of the clinic, and go right back to your desk.
Well, for standard, non-strenuous daily activities, yes.
Okay.
But introducing a foreign material into a highly vascular mucosal area, it triggers an immediate localized immune and healing response.
Right. The body knows something is there.
Exactly. And that biological reality brings us to the first massive contradiction in the procedure's timeline.
Right. The timeline to recovery and when you can actually resume sexual activity.
It's all over the place.
It really is. If you look at the instructions given to patients from different cosmetic clinics in the sources we have, the timeline is absolutely chaotic.
Completely.
Like a prominent clinic in Miami will confidently tell you that you only need to wait 4 or 5 hours before resuming sexual contact.
Which is very fast.
Extremely. But then a major clinic in London strictly forbids it for 5 to 7 days.
Right.
And another plastic surgery center in New York explicitly states that patients should avoid sexual intercourse for 6 to 8 weeks.
That's a huge difference.
It's insane. If you get this done in Miami, you're good to go by dinner time. But if you get it done in New York, you're practically taking a vow of celibacy for the summer.
Yeah.
How is there zero consensus here?
Well, what's fascinating here is that cosmetic gynecology is currently operating in a massive regulatory gray area.
Oh.
Because in older, more established surgical fields, you have universally accepted, peer-reviewed clinical guidelines.
Right, there's a rule book.
Exactly. But because there is no FDA-mandated playbook for this specific off-label procedure, individual practitioners are literally forced to invent their own highly variable safety protocols.
So the doctors are just guessing based on their own risk tolerance.
Essentially, yes.
Wow.
The prescribed waiting time depends heavily on the specific brand of filler used, the patient's individual anatomical healing rate, and honestly, the practitioner's own clinical paranoia regarding complications.
Let's break down that clinical paranoia, actually. What exactly are the doctors who recommend an 8-week wait worried about?
Right.
Like, why are they hitting the brakes so hard compared to the Miami clinic?
Well, consider the anatomy for a second. We are dealing with a mucosal surface that is in incredibly close proximity to the urogenital tract.
Sure.
The vaginal microbiome is complex and it's highly sensitive.
Right.
So highly cautious practitioners are deeply worried about the risk of infection.
That makes perfect sense.
They want to ensure the injection puncture site is completely, entirely healed and sealed over before introducing any friction or external bacteria or just the sheer physical force of sexual intercourse.
Because an open micro wound in that specific environment is just an infection waiting to happen.
Exactly. But beyond infection, there's a major mechanical concern, too. If you engage in rigorous activity too soon, before that hyaluronic sponge has properly settled and fully integrated with the surrounding cell structures, there is a high risk of filler displacement.
Wait, displacement, meaning you could literally push the filler out of the optimal G-spot zone?
Yes.
Oh, wow.
The sheer physical force could migrate the gel into adjacent tissues where it provides absolutely no stimulatory benefit.
Or worse, causes discomfort.
Exactly. Or worse. So the doctor who says, wait 4 hours is leaning heavily on the fast-acting, minimally invasive nature of the injection,
Right.
while the doctor saying wait 8 weeks is taking an ultra-conservative, worst-case scenario approach to tissue healing.
That is incredibly important for you to know if you were considering this.
Definitely.
Because your actual recovery timeline entirely depends on whose clinic door you happen to walk through.
Yeah.
But okay, let's say the tissue heals, the filler settles in the exact right place, and you finally have medical clearance. What happens to that hyaluronic sponge over time? How long does the enhancement actually last?
Well, it is strictly temporary.
Okay.
The longevity timeline is entirely dictated by your body's natural metabolic processes.
Meaning?
You have naturally occurring enzymes in your body, specifically one called hyaluronidase.
Okay.
And its entire job is to gradually break down hyaluronic acid.
Oh, I see.
So because the filler is a synthesized version of a natural substance, your body recognizes it, attacks it with these enzymes, and just slowly absorbs it.
So it literally dissolves from the inside out.
Yes.
What's the timeline on that happening?
The standard lifespan cited across the sources is 3 to 6 months.
Okay.
Though some clinics that use premium, highly cross-linked hyaluronic acid.
Wait, what does cross-linked mean?
It just means the molecules are chemically bound tighter together so they can resist those enzymes a bit longer.
Gotcha.
They claim the results can stretch to 9 to 12 months, but that timeline is not perfectly static.
Right, because everyone's metabolism is totally different.
Exactly. A patient's individual metabolic rate, their level of rigorous physical activity, and even hormonal fluctuations, all of that can cause the filler to degrade faster.
Oh, interesting.
Yeah, a highly active person with a super fast metabolism will actually clear the hyaluronic acid much more rapidly than someone else.
So if you go the standard route with a dermal filler, you are essentially signing up for a subscription model for your sex life.
Yeah, that's a good way to put it.
You are going to require a targeted top-up injection every few months just to maintain that baseline level of sensitivity.
That is the reality of the procedure.
Right.
However, there is an alternative to that subscription model mentioned in the sources.
Oh.
Some clinics offer autologous fat transfer.
Autologous.
Yeah.
Meaning they use your own fat instead of a synthesized gel.
Correct. The practitioner basically uses a localized liposuction technique to harvest a small amount of fat.
From where?
Usually from the patient's thighs or lower abdomen. And they put that fat through a centrifuge to purify it, and then inject those living fat cells directly into the G-spot.
Wow. And does that last longer?
The biological timeline for fat is very different, yeah.
Because it's your own tissue.
Right. While the body will inevitably reabsorb some of the fat cells that fail to establish a blood supply in those first few months,
Sure.
about 60 to 70% of the transfer tissue will permanently integrate.
It just stays there.
Yeah. It establishes its own vascular connections and survives.
So the fat transfer becomes a semi-permanent physical alteration.
Exactly.
But, if we go back to the hyaluronic acid for a second, I found a really bizarre paradox in how this is marketed.
What's that?
You would think having to go back to a clinic every 4 months for an internal mucosal injection would be a major drawback.
I think so, yeah.
But the clinics actually pitch the 4-month expiration date as a massive benefit.
It's a very clever reframing of the procedure's limitation, really.
Right.
The clinics argue that sexual pleasure is entirely subjective. If a patient gets the G-shot and finds the heightened stimulation to be, say, too intense or distracting or even physically uncomfortable,
Which is possible.
very possible, well, they aren't permanently stuck with it.
Ah, I see.
The body's hyaluronidase will naturally dissolve the filler over a few months, and their anatomy will just quietly return to its normal baseline.
So it essentially offers a biological trial run without a permanent surgical commitment.
Exactly.
Okay, so we have traced the clinical timeline,
Right.
a 15-minute off-label injection, a highly variable recovery window ranging from a few hours to a couple of months,
Yeah.
and a longevity of roughly 3 to 6 months. From a purely mechanical standpoint, it sounds like a quick turnaround with a built-in safety
It
net.
does sound that way in the brochures.
But if it's so quick and so seemingly beneficial for sexual confidence, and it's completely reversible, why is the broader medical community slamming the brakes so hard?
And that brings us to the stark reality check of our deep dive.
Let's get into it.
We have to look at the official stance of the American College of Obstetricians and Gynecologists, or ACOG, and the FDA.
Right.
ACOG has issued firm committee opinions stating categorically that G-spot amplification and similar cosmetic vaginal procedures are strictly not medically indicated.
It is really crucial for you listening to understand that we are looking at two entirely different paradigms here.
Completely different.
On one side, you have these private cosmetic clinics selling a rapid confidence-boosting enhancement aimed at improving your subjective quality of life.
Right.
On the other side, you have evidence-based medical bodies warning that the long-term safety timeline of these off-label procedures simply hasn't been proven.
Yep.
And we are not taking sides here, but we need to impartially break down exactly what the medical establishment is so deeply concerned about.
Well, the core of the medical community's concern is the complete lack of robust, peer-reviewed, longitudinal scientific data.
They need the numbers.
Exactly. While clinics point to these glowing anecdotal patient testimonials, ACOG warns that patients are taking on severe, unquantified risks.
Right.
And the mechanisms behind those risks are really not trivial.
Let's get into those mechanisms. What exactly happens when an injection goes wrong in that specific area?
So one of the primary risks is the formation of adhesions.
Adhesions.
Yeah. When you cause trauma to the vaginal wall with a needle and then introduce the foreign volume of gel, the body's inflammatory response can sometimes go into overdrive.
Oh, I see.
Instead of healing cleanly, the tissue can form these thick scar bands, those are the adhesions,
Right.
and they can abnormally bind the vaginal tissues together.
Which sounds incredibly painful.
It is.
And the clinical literature from the sources also mentions a risk of altered or actually decreased sensation.
Yes.
How is that possible? I mean, the entire point of the procedure is to increase sensitivity. How does injecting a plumping gel accidentally turn the lights out?
It comes right back to that vascular density we discussed earlier.
The nerve endings.
Exactly. Because the anterior wall is packed with a dense microscopic web of nerve endings, forcing 3 to 5 millimeters of thick, expanding gel into that highly confined space can actually physically compress those nerves.
Oh, wow.
Instead of exposing them to more stimulation, you accidentally smother them under the pressure of the filler.
So you essentially crush the very nerves you are trying to target.
Precisely. This can result in localized numbness.
That's terrifying.
And even more concerning is the risk of nerve damage leading to dyspareunia.
Dyspareunia, what's that?
It's the medical term for chronic, severe pain during sexual intercourse.
Oh, no.
If a needle nicks a major nerve bundle, or if the inflammatory response causes permanent nerve irritation, a procedure designed to enhance pleasure can permanently ruin it.
That is a massive risk.
It is. Furthermore, the FDA has issued explicit warnings about the long-term unknowns of using off-label dermal fillers in the vaginal area.
Right.
Noting they have actually received alarming reports of serious adverse events.
Like
things like internal burns from cosmetic energy devices and chronic intractable pain from fillers.
So the timeline we mapped out earlier, the 15-minute procedure, the 4-month result, that is really the absolute best-case scenario presented by the marketing pamphlets.
Yes, it is.
The medical establishment's timeline is much darker, focused on the potential for permanent scarring or chronic pain that could last a lifetime.
And beyond the physical risks, ACOG actually has a fundamental philosophical disagreement with the premise of the G-shot.
A philosophical one.
Yeah. They strongly advise clinicians to evaluate patients requesting these procedures for any underlying psychological or relationship conditions.
Oh, interesting.
They argue that human sexual response is incredibly complex. It involves deeply intertwined interpersonal, emotional, and psychological factors.
It's not just a physical button.
Exactly. The medical establishment's stance is that a single mechanical injection of facial filler cannot serve as a magic bullet for improved sexual satisfaction.
It perfectly highlights the tension between modern consumer demand for sexual wellness and the strict requirements of the medical field.
Totally.
The clinics are responding to a very real desire from individuals to take control of their sexual pleasure, often addressing intimacy issues that have been historically dismissed by mainstream medicine.
Right. There's a real need there.
But the established medical bodies are saying, hold on, we cannot responsibly endorse injecting moisture-absorbing sponges into a dense web of vaginal nerves until we have decades of rigorous data proving it won't cause permanent damage.
And that profound tension is exactly why the safety protocols and timelines vary so wildly from clinic to clinic.
It all makes sense now.
Without a standardized medically endorsed framework, the consumer is left completely on their own to navigate the risks.
Yeah.
You are relying entirely on the individual technical expertise, the anatomical knowledge, and honestly the ethical standards of this specific practitioner holding the syringe.
So, to pull all of this together and just concisely recap the timeline for you, if you decide to pursue a G-shot, you are looking at a 15 to 30-minute off-label injection.
Right.
Your recovery timeline, meaning when you can actually test the results, will range from 4 hours to 8 full weeks, depending entirely on how conservative your clinic's safety advice is.
Yep.
And assuming everything goes perfectly, the physical longevity of that enhancement will run for roughly 3 to 6 months before your body's enzymes naturally dissolve the filler, putting you right back at square one.
It is a really fascinating biological cycle.
It is.
You are utilizing a temporary physical alteration to try and produce a profound, deeply personal, emotional outcome.
Right.
And looking at that cycle actually leaves us with a final, thought-provoking concept for you to ponder regarding this specific timeline.
Look here.
If an off-label physical procedure successfully but temporarily amplifies your intimate connections, heightens your physical arousal, and spikes your sexual self-confidence for exactly 4 months,
Yeah.
what happens psychologically on month 5?
Oh, wow.
When the filler naturally fades and your anatomy returns to baseline, does that temporary enhancement leave behind a permanent positive shift in how you communicate with your partner about pleasure?
Like it broke the ice, basically.
Exactly. Or, conversely, does it risk creating a psychological dependency?
That's a dark thought.
Do you suddenly feel sexually inadequate without the filler, locking you into a continuous, expensive cycle of cosmetic procedures just to feel fulfilled?
Wow. That is a brilliant question to end on. Does the physical clock running out mean the psychological benefits evaporate too?
Right.
Or does the 4-month trial run teach you something about your own body's capacity for pleasure that you get to keep forever, even after the hyaluronic acid is gone?
Yeah.
That is definitely something to mull over.
Absolutely.
We started this deep dive looking for a clean, mechanical timeline. But it turns out, when you mix human mucosal anatomy, off-label cosmetic fillers, and the deeply complex nature of human sexuality, nothing is predictable.
Not at all.
Thank you so much for joining us on this deep dive. We hope we helped you unpack the complex mechanics, the wildly contradictory recovery timelines, and the harsh medical reality check behind the G-shot. Keep asking those hard questions, keep seeking out multiple perspectives, and never stop investigating the why and how behind the glossy marketing. We will catch you next time.